We have breaking news now on the COVID vaccine front. Just minutes ago, the National Advisory Committee on Immunization concluded provinces can wait 4 months in between first and second doses. That means more people can get first shots far sooner. Here's epidemiologist Colin Furness on the implications.
Early data suggests that the risk of delaying second doses is smaller. There is still some risk, though, and the risk is that once you do this, you may find that you've got less long-lasting immunity than you thought you had. So it's a question of trying to reduce transmission now and taking a little bit of risk later on. I'm not sure I would wait 4 months. That's a lot.
Okay, so now you can throw away last week's provincial timelines for who is getting vaccinated when. In addition to extending vaccine intervals, in the last week alone, AstraZeneca became the third vaccine approved in Canada, with 500,000 doses arriving today in this country, and Ontario likely getting around 40% of them. And yet the Ford government still can't or won't say when people with serious health concerns can get their shots.
I think everybody with an underlying condition is on pins and needles wondering when we can be inoculated.
Chris McLeod has cystic fibrosis, a condition that attacks the lungs, just like COVID-19.
Fluid buildup in the lungs, you can't breathe, your oxygen levels fall, you end up in a hospital on a respirator. Well, that's check for CF without COVID.
Do you think the government should have the list already out about who's getting it when, who's particularly vulnerable, like yourself?
Yeah, I mean, it strikes me as a bit of a no-brainer.
The government has been stressing the most elderly are at highest risk, and they certainly are. The vaccination timeline released last week was based on age. Government sources say a list of who else might get vaccinated sooner is likely coming at the end of this week.
Why isn't that list already available? You've had lots of time to do that.
Well, frankly, it's because each vaccine is slightly unique. Now we're looking at AstraZeneca. Different vaccine, different targeted population. There is hopefully Johnson & Johnson getting approved from Health Canada shortly, which is a single-dose vaccine.
I suspect that the government simply hasn't made up its mind. It hasn't decided. And that's too bad, because we could have been thinking about this months ago.
Epidemiologist Colin Furness doesn't believe it should be too hard to figure out who needs the vaccine the most.
Where should people with underlying health conditions be when it comes to the lineup for vaccinations?
They should be after people who live in congregate settings, because that is the most dangerous. But before, I think, people who are, say, in their 60s and who live in the community and are able to self-isolate.
When is the government going to commit to vaccinating these workers?
And the NDP has also been calling for the government to provide a list of which essential workers should be immunized first. So far, there isn't one.
Grocery store workers probably have the most contact with people, and other kinds of retail, essential retail workers have the most steady contact with a large number of people. Teachers have the contact with the same over and over again, but it is close and it's extended.
Now, as for the breaking news that I just told you about extending the interval between vaccines to 4 months, in a statement just sent to me, the government welcomes the direction and says it allows Ontario to rapidly accelerate its vaccine rollout, and they will have new timelines very soon.